Breaking news! Over 400,000 people in the U.S. suffer from ischemic stroke every year, most of which are from the age group 65 years and older. I'm Nicole reporting to you live on Stroke is No Joke. Now, what is an ischemic stroke, you might ask? Simply put, it's when the blood vessel in the brain suddenly becomes blocked by a clot. Now, not only is this a problem, but the little itty bits of the clot left over, the fiber molecules, can leave harmful residues that can damage the brain's ability to heal, post-stroke, and repair, and even lead to long-term effects. Now, I know what you're all thinking. Yes, this sounds scary. Will Grandma and Grandpa be okay? Is there anything we can do about this? And the answer, folks, is yes. A drug known as the tissue plasminogen activator, TPA for short, holds the answer to what we've been looking for. And not only that, but since its approval by the FDA in 1996, its possibilities have since expanded to treat other illnesses as well. Joining me now is my lovely co-anchor, Beatrice Beaker, here to give a brief history on TPA.
Thanks, Molecule. But now you're wondering how scientists even found this amazing drug, and where does it come from? According to the timeline, TPA was first discovered in 1902 by an Austrian scientist, Heinrich Conradi, whose work eventually led scientists to find it in animal tissue in 1947 and isolating it in 1952.
Great, but how do we go from animals to humans?
Well, in the 1970s, scientists were able to identify TPA in malignant tumors found in humans before TPA was purified from human blood vessels and urine tissue. Just in 1996, FDA approved TPA to be used for the ischemic strokes you were talking about just before.
Interesting. Now, how does this tissue plasminogen activator work?
Thanks for asking, Ollie. We actually have a doctor from UCSD, Dr. Elizabeth E. Coli, here to explain to us the mechanisms of TPA and how it works in the body.
Hello, my name is Dr. Elizabeth Coli of UCSD, and today I'm going to give you an overview of TPA, or tissue plasminogen activator, in the human body and how it works.
Here we see a simple cartoon of the artery of a patient who may be susceptible to ischemic strokes. A blood clot has formed and restricts the amount of blood flow that goes through the artery. This is where TPA comes in. It attaches to the surface of the blood clot and recruits its substrate, plasminogen. Plasminogen is then cleaved by TPA and releases plasmin. Plasmin is a molecule that breaks down the fibrin meshwork, as you can see shown in gray, to release the platelets that form the main structure of the blood clot. This completely dissolves the blood clot from its original rigid structure and allows the blood flow to resume at its normal rate.
Now that we know how TPA works, how well does it really work for the treatment of ischemic strokes? I have Dr. Doom here to explain the results found by the National Institute of Neurological Disorders and Strokes.
Well, in their 1995 study, researchers have found that TPA was beneficial within 3 hours of onset of the stroke. While TPA has a hemorrhaging risk associated with it, it occurred roughly in 6.4% of patients. Now compare this to the 0.6% occurrence rate of the patients who have taken a placebo. Despite this risk, it was ultimately found that patients treated with TPA were 30% more likely to suffer from zero disabilities after 3 months.
Now that all sounds really promising. Tell me, doctor, have there been any other drugs like TPA in the years since its development?
Well, yes, a few actually. The first alteplase was modeled after the human TPA enzyme and not only treats ischemic strokes, but is also approved for myocardial infarction with ST elevation, acute massive pulmonary embolism, and central venous access devices.
That's pretty impressive. What else you got?
Well, there are also 2 other drugs, retiplase and tenecteplase. The former is like TPA, but better, with a faster mechanism of action, longer duration on onset, and on top of that, it's also used to treat myocardial infarction. The other drug, tenecteplase, is similar. It has a longer half-life and also treats myocardial infarctions.
Oh wow, I love that it's branching out to treat other medical complications.
It's definitely come a long way.
But I'm sure it hasn't all been sunshine and rainbows. What advancements have been made to counter any bad side effects of TPA?
Well, now that you mention it, sometimes TPA works a little bit too well. There could be increased fibrinolytic activity to the point where acute bleeding starts to happen. But not to worry. A compound known as aminocaproic acid can help inhibit the enzyme from going too far. As you can see in the diagram here, aminocaproic acid inhibits the plasminogen conversion to plasmin, thereby preventing any more plasmin to be produced that would continue breaking down clots and other things that will allow too much blood to flow.
Well, that's a relief. Good to know we have medications to counter and fine-tune the mechanism of breaking bad blood clots. We'd now like to take it back to Ms. Beaker and Dr. Elizabeth E. Coli to tell us what the future holds for TPA.
Great, thanks guys. So I heard there's some major research going on about TPA and its relationship to causing cell damage. What do you have to say about that, Dr. Coli?
I think the cell damage you're referring to is the reperfusion injury to the cells, correct?
Can you please explain that to us?
Of course. So a reperfusion injury occurs when the blood clot of the stroke is removed, and it may cause a rapid rush of blood back into the system. Most importantly, this causes oxygen to return back to the tissue and may cause some cellular damage. So as of 2020, the Cleveland Clinic was actually granted a $2 million 5-year grant from the National Institute of Neurological Disorders and Strokes to research these effects. And so I believe TPA has the best efficacy when administered within 3 hours of the stroke. However, the Cleveland Clinic is actually researching into the harmful effects of TPA administration after the 4.5-hour mark.
Oh, and I heard there are even efforts made recently for potentially treating respiratory issues caused by COVID-19. How is that going?
Yes, some people are suffering from acute respiratory distress syndrome as a result of catching the coronavirus. There is a clinical trial currently in phase 3 of testing, and hopefully they can provide us with some treatment.
Dr. Coli, it was great talking to you about the future of TPA.
No problem. It was great being here today. Thank you so much for having me.
Now I'll hand it back to Molly. Take it away, Molly.
Thanks for joining us along on this segment. I'm Molly Kuehl, and this was Stroke is No Joke. Good night, everyone.